Good evening and welcome to tonight's council meeting for Tuesday, January 27th. We'll start our meeting with our land acknowledgement. As we gather here today, let us be reminded that the community in which we live, work, and play is situated on traditional, unceded Algonquin First Nation territory. We would like to acknowledge and thank the Anishinaabe people and express our respect and support for their rich history and culture. Could I get a call to order, please?
All members of council are present. Deputy Mayor Tennant is attending virtually, but is counted as present. Thank you.
Thank you. Approval of the agenda. The recommended motion is that the agenda be approved as presented. Could I get a mover? Moved by Councillor Atkinson, seconded by Councillor Comley. Any discussion on the agenda? Seeing none, all in favor? Opposed? And that is carried. Disclosure of pecuniary interest and or conflict of interest, the general nature thereof can be made now or at any point throughout the meeting by notifying the clerk. Item number 5 is approval of the minutes. Could I get the recommended motion, please?
That the council minutes dated January 13th, 2026 be accepted as presented.
Moved by Councillor Hinton, seconded by Councillor Kavanagh. Any discussion on those minutes? Seeing none, all in favor? Opposed? And that is carried. Item number 6 is our consent report. Could I get the recommended motion, please?
That council received the consent report dated January 27th, 2026.
Thank you. Any discussion on the consent report? I need a mover, actually, I guess. With that, Councillor Hinton, thank you. You're allowed to stare at me until I do the right thing, Mark. And Councillor Comley seconds. Since there's no discussion, all in favor? Opposed? And that is carried. Thank you. We're on to bylaws. We have one. Could I get the recommended motion, please?
That bylaw 08-2026 to adopt an interim tax levy be read a first, second, and third time and finally pass.
Thank you. Moved by Councillor Sekaspina, seconded by Councillor Kavanagh. Any discussion? Seeing none, all in favor? Opposed? And that is carried by Teresa. That was it? No questions, Teresa. Have a good evening. I should look at my screen every time because I'm not truly paying attention to Deputy Mayor Tennant. My apologies, Deputy Mayor. That moves us along to announcements. I have a few, but I will look to the crowd to see if anybody has anything that they would like to announce, and Councillor Kavanagh does.
Thank you. Making up for last week or last 2 weeks when I didn't have anything. Just a reminder that January 30th, so this Friday is a PA Day. And so a reminder to families that there are public swims at 10 and 1:30 at the pool. There are fees associated, but I remind everyone that there are passes available at the library if you're quick to grab them. The Keepers Wildlife Rescue Show is at the Arena Upper Hall from 10 to 11. There'll be some popcorn and some animals, so that'll be fun. And then public skating from 2 to 2:50. There is a small fee of $1 per child and $2 for adults. The other things coming up, February 7th, one of our favorite events is the Hockey Day with your OPP at the Carleton Junction Community Pad. There's skating from 11 to 12 and then hockey at noon. There's usually food and refreshments, and we encourage donations to the food bank. February 11th is the Valentine's Day dance at the arena, 9:30 to 12. There'll be some small activities and it's a fun dance party. A reminder that 9:30 to 10:15 is more toddler oriented and 10:15 to 12 is family friendly, and it is not supervised by staff, so please watch your littles. And then just a quick note that I am, for one, crossing my fingers that the groundhog does not see a shadow on a second and that we're over this cold snap. So thanks.
Get the job to
Thank you, Councillor Kavanagh. You definitely made up for missing the last one, and who knew there's so much going on in the town of Carleton Place. CP Scoop, that's right, just the most recent CP Scoop post. You will know everything that's happening event-wise. Sign up for the CP Scoop. It is, it's an awesome information article for you every day. Looking at Councillor Sakaspina, because she usually does, but Sarah took it all. Anybody else looking around? I will say just quickly that on Friday we were invited to the grand opening of the doctor's offices of the new Health Hub and did a ribbon cutting. It was attended by many. Very, very nice day. MPP John Jordan was there. Members from the OVFHT were there. Representatives from both Carleton Place Council and Beckwith Council, who are contributing and partners with the doctors themselves, were there. And it was just it was a nice to see the space, and nice to acknowledge all the hard work and effort by the doctors and the OVFHT to get that up and running, and a great spot for our community. And what we truly hope is just the start of more doctors coming and taking up shop in Carleton Place to help with our unattached patients in Beckwith and Carleton Place. And just wanted to acknowledge of all the doctors, especially Dr. Jamie Fullerton, who truly led the charge on behalf of the doctors, and say thank you to you all for doing what you did to move into the space and help us ensure that we have healthcare looked after for our citizens in the future. So good job. The other announcements today are that February in 2026 is Black History Month. Wear Red Canada Women's Heart Health on February 13th, 2026. And I always give a shout out to Teresa Fritz, our former colleague who sadly passed away during last term, and we miss her dearly. And also Local Heritage Week is February 16th to the 21st of February, and that are all the announcements. Moves us right along to confirmatory bylaw. Could I get the recommended motion, please?
That bylaw 09-2026, confirmation of council proceedings for January 27th, be read a first, second, and third time and finally passed.
Thank you. Could I get a mover? Councillor Atkinson, seconded by Councillor Hinton. Any discussion? Seeing none, all in favor? Opposed and carried. And that finishes it up for council. The recommended motion is that this meeting be adjourned at 6:07. Moved by Councillor Comley, seconded by Councillor Sakaspina. All in favor? And we are adjourned. That will move us along to the Committee of the Whole, which is run by Councillor Hinton.
Thank you, Mayor Randall, and welcome to the Committee of the Whole for January 27th. We'll call the meeting to order at 6:08 p.m. Approval of the agenda. Suggested motion is that the agenda be approved as presented. Moved by Councillor Atkinson, second by Councillor Sakaspina. Any questions or discussion on the agenda? Dan?
The agenda should be approved as amended because we are deleting delegation number 2, Sharon Halliday, from the Lanark County Child and Youth Services Coordinator for Open Doors. She'll be coming in April instead.
Thank you for that, Diane. The movers and seconders are okay with the amended motion that the agenda will be accepted as amended? Yes, perfect. All in favor? Thank you. Off to a rocket start. Declaration of pecuniary conflict of interest and general nature thereof. The declaration can be made now or any time throughout the meeting. Deputy Mayor Tennant.
Yeah, I have a conflict for the closed session item, so I won't take part in the meeting at all. I'll just log off, and it's due to my proximity to what's being discussed. Yeah. Thanks.
Noted. Thank you, Deputy Mayor Tennant. Minutes to be approved and received. The suggested motion is that the Committee of the Whole minutes dated January 13th, 2026 be accepted as presented. If I can get a mover and a seconder on that. Moved by Mayor Randall, seconded by Councillor Comley. Any discussions? See none. All in favor? Thank you. And we are on to our delegation. We have one delegation this evening, Ashley Killen, the Executive Director of Ottawa Valley Health Team. She's going to give us an overview of the Family Health Team model, progress updates, and next steps.
Hi, everyone. Happy to be here. Looking forward to the conversation. I have several slides to speak to, and then I understand that there's some time for questions as well. Share your screen. Oh, that's the email.
Oh, it shouldn't be.
The
It's
other one was
PDF.
the other
Oh,
one was the
okay.
video.
Thanks. Hold on, sorry. This one. Okay. There. And you can just tab through.
Okay, great. Okay, so I wanted to start with an overview of a family health team, and specifically the kind of the relationship between a family health team and a family health organization, of which we have both functioning out of the site that Mayor Randall referenced the grand opening of on Friday. So family health team is a team-based primary care approach used in Ontario that helps to bring family physicians and other healthcare professionals together to deliver coordinated patient-centered care. So the way that it works is that patients receive their primary care from their primary care practitioner, so whether that be a physician or a nurse practitioner, and then they receive additional services from other allied health professionals, so things like pharmacists, registered nurses, and other professionals. The way that it works, and I think it's important, I really wanted to kind of highlight, there too. Great. I just really wanted to highlight the way it's really an amalgamation of two organizations working together. And in our case, it's actually three, because we're fortunate to have we have two family health organizations and the family health team that work together. And so the way that it works is that patients are rostered to a family physician. And then those family physicians have chosen to come together under a family health organization. So they've decided to take their individual practices and function together under one group. And they share expenses that way. So the way that it works is that they then hire all of the staff that it takes to make the day-to-day operations of the clinic run. So they hire the staff that answer the phones, that room patients, so walk them to their rooms, that greet you when you come in, and that do document management. So that means receiving all of the many faxes and referrals that come into and out of the clinic. And so they pool their resources, they hire those staff. And then the family health team, the way I like to describe it is we wrap around the services. So we come in and provide that extra level of interprofessional care to augment the services of the family physicians. And so it's really two separate organizations that are funded separately that work together seamlessly. So for our patients, it makes no difference. They come in, they ask to see who they need to see, and they're served no matter who they're there to see. But for us in the background, there is some logistics around two organizations working closely together. And so family health teams are funded directly from Ontario Health, and the doctors are funded separately, and the two organizations' finances are separate. Specifically, maybe just worth mentioning before I kind of move on, is that the family health team really has a focus too on chronic disease prevention as well, so health promotion in general. So we have programs around things like smoking cessation, lung health, cardiopulmonary health, things like that. Sorry. So a little bit of history on the Ottawa Valley Family Health Team specifically. So the Family Health Team opened in Almonte in 2010, and I'm going to have to correct my language because I keep saying we've been open for 13 years, but it's coming up on actually 16 years this year that the clinic has been open. So it's been functioning as a multidisciplinary team there for many years, and then in 2023, the organization applied to Ontario Health to expand services into Carleton Place as well, and we're successful in that application. location. So then kind of late 2023, early 2024, they would have started hiring staff and expanding services into Carleton Place. That would have taken place to start at our satellite site at the McNeely location. So that was right within the grocery store. So many of you, I'm sure, would have been familiar with that. And now, of course, we're all together under one roof at our new site on Costello Drive. So a little bit more specifically about Carleton Place. So right now we have hired, so there's 15 physicians, which is up 3 from the 12 that would have started the project to bring them together, which is really exciting. We have 4 specific family health team staff. So we have a pharmacist, a registered nurse, an admin, and a nurse practitioner. The nurse practitioner does see patients, is a primary care provider for patients, as well as doing programming. And then we have 4 mental health providers. The mental health team is actually split between Almonte and Carleton Place, so they'll split their time between the 2 locations. And then we have 3 leaders who help oversee operations at both sites. So how things are going. So over the past 3 months, we have transitioned into the shared space. It's integrated. It's really already started to lead to more collaborative care. And I think you can see on the screen, maybe I'll jump to that, just a nice piece of feedback that we got from a patient around them having seen multiple providers 3 separate times in the times that they've been in the hub, and how seamlessly and flawlessly it all worked together. And this is a patient who, historically, even with family health team support, might have had to go to McNeely for some of those services and maybe their doctor's office at Centennial before. So now they're able to receive those all in the same place. It's familiar. I actually reached out to that patient to clarify that I could share this feedback tonight. And she said absolutely. And she actually shared a little bit more that I wanted to read specifically because she went on to say she understood the challenges that would have come with bringing 15 family physicians under one roof. But her final kind of piece, which I just thought was really worth sharing, was the final result is a dream come true, a health hub in a totally accessible building with pharmacy and now even a tea room. What more could we ask? We will be the envy of many, many towns, and I am just really grateful that this is in my town. So I thought that was really, and I won't share her name, although she did give me permission to share her name. So if anyone has other questions for her, I'm sure she'd be happy to speak to it. But I thought it was really nice to hear that because we are aware that it's been a challenge. We know that there has been some bumps along the road, bringing, staff at various locations as well as new staff into a new building. And instead of staff being responsible for one physician who they got to know really well, and we're doing a little bit of everything. Now they're doing one job across 15 physicians. So they're answering the phone, they're booking appointments. But we've really seen tremendous improvement. So just in the 3.5, it's still 3 years, close to 4 now, months that we've been open, things have really been picking up in terms of efficiencies. So we're getting better at the things that we're doing. We introduced online booking just at the beginning of January, and I was able to pull some stats just from that this morning. So we've had 68 online appointments booked since the beginning of January, which is more. That's on average more than we're booking on online booking in Almonte, just so you know. So we're already seeing kind of really good uptake. And that's 63 appointments that didn't have to get through and talk to someone on the phone. And so it allows some efficiency. To be clear, phone appointments will always be welcome. You'll always be able to do that, but this gives an option for those that would prefer to do it online, and it's helping to kind of streamline things. We've also made it possible that you can cancel your appointment online, which is helpful for people. If they can't get through on the phone, they can quickly let the clinic know that they can't make it, and then rebook or call to rebook, depending on the circumstances. And we can also use that platform to send secure messages to patients, of which we've done 1,571 in January alone. And we've also sent out 1,946 appointment reminders. So it's another way to help people because that's obviously in a clinic like ours can be quite a bit of downtime when you have no shows for appointments or late cancellations that can't be filled. So this automated system just allows us to kind of clean up some of those things that would have been getting in the way of our efficiency when we first started. So far, like any organization, it's been a time of learning and development, but things are really getting smoother every day. And we're feeling really good about it. All right, and then I wanted to talk a little bit about where we go from here. So here's just, I mean, there's many areas that we're focused on, but specifically, as you would know, physician recruitment continues to be a focus for us. Part of the benefit of bringing the physicians together was to create an attractive option. We've been quite happy to hear we have good traction on filling the spots of some of our physicians who are looking to retire in the next little while, which, as you know, a few years ago was a significant concern that we didn't have a plan for. So we're really happy to say, like, I won't, ever say until T's are crossed and I's are dotted, but we're feeling really good about those coming together. And I will say, in general, there's a tremendous amount of interest from physicians in both. I'll speak to Almonte and Carleton Place. I think they're really attractive communities for young physicians and other primary care providers to come to. The challenge is everybody is looking for physicians. And so I think, we get a lot of interest, and then there can be a period of back and forth where they're kind of considering if they're open to anywhere in Ontario. They really have an unlimited amount of options right now. So there's a little bit of, work on our end to just kind of follow through on those, but we've been really keeping a good eye on it. And I will say, I mean, I know Mayor Randall already thanked him, but Dr. Fullerton is keenly involved in that. He's quite involved at the Ontario Health Team. So he's doing a really good job of talking this community up and bringing new people to it. And there's quite a bit, we're starting to coordinate across Almonte and Carleton Place and talk to doctors, because oftentimes they'll come to us and they're interested in both communities, right? And so we can have a conversation around what's the best fit for them. That's a key area of focus. Patient attachment. So I know, and I'm sure that you all hear every day, the concerns about getting attached to a primary care provider. We do have a little bit of capacity and have been slowly filling that. So our nurse practitioner has been onboarding new patients, and our physicians, we're constantly looking for ways that the family health team can support them, can kind of take things off their plate to allow them to roster and attach more patients. So we are focused on continuing to do that. And that brings me to Healthcare Connect. So as discussed previously, Healthcare Connect is the best way to get attached to a new primary care provider, to get yourself on that list. And a key update is that you can now add yourself to that list if you already have a primary care provider, but they're not in your community. So we know that we have people living in Carleton Place who are holding on to their family doctor in Kingston or Toronto or further because they're terrified to lose them. So they can now add themselves to the Healthcare Connect list and maintain that doctor until they get placed with a doctor closer to the community, which we know is really one step closer to everyone actually being connected to care in their community. So really encourage you, as you're speaking to your neighbors, to the people in your community, to encourage them to get on that list, because it's also our easiest way to advocate to Ontario Health and to the province around the need in this community. We know that the numbers on Healthcare Connect right now are not an accurate representation of people who are not attached. And we also appreciate that historically Healthcare Connect wasn't a viable resource because people were adding themselves to it, but nobody was coming off the list. That's really changed. So there's been quite a focus through the primary care action team and the work of the Ontario Health teams, of which we are part, to start to take patients off of that Healthcare Connect. And we've really been encouraged by the province for that to be the way that we take patients. So that's what we're doing. And then the last one, which is certainly not least, it's probably the area kind of closest to my heart and to my work, is really looking at programs and services. So as I mentioned before, we've been established in Almonte for many years, and we're still getting to know Carleton Place. We're still working to understand the needs of the communities, so the needs of the patients that are currently attached to our providers, but also to understand the community partnerships that are available in the area. So, I'm well connected with ConnectWell and other services that are providing healthcare in this community. But I think there's a real opportunity for us to continue to understand what the community needs and how we can work together to fill those gaps. Does it make sense that we take on something, or is it a better partnership with a community partner who's already established in that area? So over the next, I want to say at least 12 months, we'll really be looking at kind of a further, needs assessment of the area, getting feedback from our physician partners as well in terms of the specific needs of their patients, and then working to fill those gaps. Which brings me to the end. I have no idea if I stayed on time or not, but I'm happy to take questions on any of that or anything else.
Great. Thank you very much for that overview, Ashley. I'll open it up for any questions or comments. We'll start off with Councillor Sekaspina.
Hi, Ashley. Thank you very much for the presentation. I noticed you mentioned online booking, and this is active now, the online booking. Now, do they have to go to the Ottawa Valley Health Team website, or where should they go?
It's a great question. It is on the website. So if you go to our website and then you pick the Carleton Place dropdown, I actually just noticed today that the dropdown doesn't specifically say online booking like it does for Almont. So we're going to get that fixed. But if you click on Carleton Place, the Carleton Place landing page will pop up, and there's a link right there.
Question. You say you have an active recruiter for both Almont and Carleton Place. In the past few years, what are the realities of recruiting a doctor like in Almont, a new one?
It's actually really, to be honest, I've only been with the family health team since the summer, but I know there's been a tremendous uptick in the last little while. So we have been successful. We've recruited, again, I'm like, T's aren't crossed and I's aren't dotted, but we have a vacant practice in Almont that I think we're this close to confirming a replacement for, a long-term replacement for, and we're very close on a few retirements coming up in Carleton Place. So there has been movement, and we also know we're up 3 physicians in Carleton Place relative to where we were. So there is movement, and I really think the momentum of the primary care action team is going to have an impact on that. But the reality is with human health resources, there's always a delay, right? So we've got to train more doctors. We also need to train more nurse practitioners and physician assistants. So we've had, if you've been on our website in the last couple of months, we've been recruiting for a nurse practitioner or physician assistant for months, and we've had very little interest because we are one of many family health teams, community health centers, and hospitals that are recruiting across the province. So there's a supply and demand issue. I realize I took a little tangent there away from physicians, but I think the problem will not be solved by physicians alone, right? It's the entire team. It's nurse practitioners, it's physician assistants, it's RNs, it's the whole team really kind of coming together and ensuring that everyone is working to their full scope of practice that's actually what's going to help us solve kind of the primary care crisis in Ontario. You're welcome.
Mayor Randall.
Thank you, Councillor Hinton. And thank you, Ashley. Great presentation, lots of information, very exciting for time for us as a community and for you as an entity. What would be, from the province's standpoint of every time we bring on a doctor, they have to, I would assume, okay the funding for that doctor. What's our cap in Carleton Place? And is there a cap on nurse practitioners? Like, could you have 6 nurse practitioners, or can you only a health team only allowed to have a certain number?
So short answer is we have room. We have physical space for 3 more physicians in Carleton Place in our offices. In terms of cap with the province, I'm going to be honest and say I don't know the answer to that question. I can look into it. I think it has to do with the demand in the community, and we certainly know that there's demand in Carleton Place, and the demand is only increasing here, both here and in Almont. Frankly, we know that the population is going up in both areas, so I don't anticipate us getting in the short term to a position where we have a doctor who wants to work here that we're not able to bring on. To answer your question about nurse practitioners, that has to do with funding. So right now, the nurse practitioners are primarily hired by the family health team. So that's me. We have some new funding, and we are looking to recruit a nurse practitioner. Anyone knows one who'd like to work in primary care, please send them my contact info. So there's no cap on nurse practitioners per se, but there's a cap on the amount of money that you have to hire them. So that's where that comes from.
And just one more question. I noticed as far as recruiting going, you're starting to see folks look overseas. I know England has been talked about quite a bit, and the municipality in North Grenville just had, I think, 7 doctors visit North Grenville from England and the United States. What barriers, from a council standpoint, if we're going to go and appeal to the province to reduce red tape as they really love to do, what can we do to help? Or are there barriers right now for foreign doctors coming from England or Commonwealth countries? I'm like, Can you just talk to that a little bit?
Yeah, it's a good question. I think one of the barriers, and maybe it's not exactly where you're headed with that question, but one of the barriers is around this kind of influx of doctors, whether they be from Ontario or external. We had quite an influx of interest from Quebec recently that then now has kind of paused. Everyone's kind of pausing to look around. But one of the things that when that happens is that these physicians, wherever they're from, they start to put a call out to every community they think they might be interested in. And so it's a tremendous amount of effort on behalf of every family health team or every organization to kind of meet with them, to talk them through it. And I think one of the things that we could do that the municipality might be a good support of, it just was thinking about this recently, is around how do we appropriately market Carleton Place, right? How do we talk about what does it mean to come here? What are the schools in the area? What are the recreation? The reasons that people make the decision to practice here, proximity to Ottawa, things like that. I think that would be helpful and something that we could do so that when they make their choice to come here, they make their choice to come here and stay here. Because the last thing we want is for people to come and then decide this isn't a fit for me. They've got to move. They've set up a practice that then we have to find a way to cover. So I think that's, to answer your question, that's something that the municipality could be helpful with in terms of recruiting. In terms of specific barriers for foreign trained physicians, I'd have to get a little bit more information for you on that. I think obviously the credentialing process and removing some of the red tape would be the biggest one. But in terms of local barriers, I think it would be just helping them understand how to decide where to come, right? If you're coming from the UK and you're looking at the entire country of Canada or the entire province of Ontario, how do we make Carleton Place kind of stand out, and how can we work together on that?
Thank you very much.
Any other questions? One question I do have, Ashley, because you brought it up, Healthcare Connect and how it's evolved and changed. Like my doctor, my private physician is in Canada. And I didn't realize until last week speaking with you that I could put my name on this Healthcare Connect to get a local doctor. Where do people get that information? How can they sign up?
So 811 is the easiest way. So if you just put 811 into like the website will come up. There's also a link on our website, the easiest places to get it.
Well, that's nice and easy. I'm even going to remember that. Perfect. Any other questions? See none? Thank you very much. Have a great evening. And that moves us on this evening to reports, which we have two this evening. Our first one is always everyone waiting to get this review yearly. It's one of the most exciting reviews we get every year, and everyone gets excited looking at the data. So we have our 2025 communications year in review, communication 137004. And we have Amanda, our communications coordinator, to review that with us this evening.
Thank you for having me. So happy to report that everything is on the up and up. We're kind of keeping on track with everything sort of scaling up, not as fast as COVID rates, but things are steady, I would say. So CP Scoop subscribers are up, website traffic. Now that we've had the website up and running for a full year, I should say the new website, the data was kind of skewed last year because we only had a half year, but I would say it's tracking with previous years. Facebook, man, people were so excited about that Walmart opening, or the winners, I should say. The winners post was, far and away our biggest thing. So that ribbon cutting people were super excited for the winners. Red water usage, that's your typical, you all know, I don't need to get into that. And, we're seeing a lot of events are really becoming popular. So people are now really starting to go to the town's website to see what's going on. We see noticeable spikes on Canada Day, Pumpkin Fest, like those big ticket events. People are going to the website to find out what's going on. And I think that continues a trend of maybe people of the demographic in this room sort of moving away from Facebook and looking for their information in other formats, whether that's CP Scoop or, traditional websites, news media. So that's been interesting to see. The Arena page has actually gone up. So for as long as there have been websites, waste collection, pool, and employment opportunities have always been our top three. You know, some variation there, but pretty much consistently in the top three. So it was nice to see Arena move up because that department really made a concerted effort last year to reorganize their information so that it's in a more user-friendly format. They've got municipal rental facility rates up now, which may be helping. So it's kind of nice to see that information take a nice spike. Rec and Culture Pumpkin Fest was their highest post from last year. So I think people looking for information on that. And let's see what else. Oh, virtual town hall and e-billing is also up. Jen Mocha has made a very concerted effort to advertise that regularly and trying to get more people moved over to e-billing, especially as, you know, Canada Post strikes. They continue to raise their rates. So as many people as we can get moved over to e-billing, it's more efficient and it saves money. So that's kind of my summary. I'll take any questions. Oh, yeah. So as Mayor Randall mentioned earlier, we have launched our first edition of CP Social Scoop. So it's a new effort that we're going to try out just to kind of let everybody know. I've often said that CP selling point is how many fun things are happening here. So almost every weekend of the year, there's something going on, something for everyone. So it's just kind of more of a way monthly for people to see. We'll try and release it before the first of every month. And it's just a full listing of everything from, like, you know, your traditional events to art workshops to classes to live music nights, just everything that's going on in the community to try and get people who live here or who want to visit, you know, out and about in the community to maybe visit a new business or try a new class and just get people more involved in their community and so they know what's going on. So we got really good feedback from it yesterday. A lot of link clicks, kind of trying to find out more information. So I think for a first edition, it's pretty positive.
Great. Thank you very much for that, Amanda. Open up to council for any questions or comments. We'll start off with Councillor Kavanaugh.
Beat you to the punch. I could go on and on, but yeah, no, really, really another great year. Being involved in kind of having to do newsletters and stuff in other positions, the kinds of subscriptions and open rates you get on the Scoop are home runs. And I think from my perspective, having just come back from Roma, to sit in these conferences, in these learning lunches and things and hear people talk about what we should be doing and sit there and know that we're already checking all those boxes is a very proud moment for me as a rep of Carleton Place. And I love the uptake on the CP Scoop. I love the website. The CP Social Scoop is fantastic. I love this idea. And it's also, you can see that in the age of untrusted news sources, fake information, AI, all of the things that we find in the minefield that is social media, it is nice to know that our residents have a trusted place to get information, not just when garbage pickup is, but the activities going on, the things that their families can enjoy. And so that is hands down just such a home run for our residents. And I thank you for all the effort because I know there's a lot involved. So thank you for another amazing year.
Councillor Sakaspina.
One question, will the senior handouts still be going out every month or will those be on strictly online now?
You will be pleased to know that I am expanding the senior handout. So I am now going to make it 2 pages. The first page that typically had just a brief summary of the Active Living Center, I'm actually going to take all of that information, the monthly information, and put that all on the front. So it'll have the Monday to Thursday calendar, but I'm also going to list all the Friday calendars that the because those are packed. So the front page will just be Seniors Active Living Center, maybe some information from the library if they're hosting special seminars. Like they're doing that Silver Linings group that is, I think they're meeting for the first time next week. And then the back will be all of the, like, we'll do a full event listing from CP Social Scoop, and not just like before it was kind of the events that I thought seniors may be more interested in or may want to take their grandkids to, but now we'll just list everything so they can kind of pick and choose what appeals to them.
Yes, they do love their handouts. And I just want to ask you one question. The CP Social Scoop, is this the thing you're looking forward to most in 2026, or is there something else?
There is something else. Well, Toby knows about it and Sarah knows about it. So I have something in the works I'm hoping to launch in March. I'm keeping it kind of under wraps because there's a lot of bugs to work out, but we are making a more concerted effort this year to find new and innovative ways that aren't social media to let residents know what's going on. You know, a lot of people are just, there are some heavy things going on in the world right now, and social media is just, it's a bit of a minefield. So we're just trying to find ways to get offline and let people know about things that are going on in their community, because there's a lot going on and there's a lot to do and there's a lot of fun stuff. So we're working on different things, but coming soon.
I see your hand up, Councillor Conley, but I'm going to go to Mayor Randall, and maybe he can talk about something that's upcoming in March.
No, I was just about to say I'm not going to steal her thunder. Absolutely, I would not do that to Amanda. You both use the word minefield, and truly, like, social media now is you've got to parse through so much stuff, and so, like, there's so much noise out there. And Councillor Kavanaugh is 100% right. Is that the CP Scoop, and it's great to see those numbers continue to increase. It's a trusted, information that our citizens can return to time and time again. And it's not just local. We also provide stuff in the county and provincial, things that we think are relevant to our citizens that they know for 100% sure is true. And they don't have to ask their neighbor or go to a social media site and ask the general public. Like, if they really want to know the proper information, it's there to be had. The thing that jumps off the page to me, and it still surprises me, to be honest with you, is the 63% of residents signed up for e-billing. Talking to staff on that is just a monumental number, that we have that many residents that are signed up for it. And I've talked to a number of residents that truly, I always ask people if they have questions about their bills, is this the best way to do it? There are still some people that are very hesitant. And some people, actually, I had a person address me the other day about the water billing issue that we had, and thanked us for making some corrections on that. And I said, e-billing, and it was a gentleman, said, I really enjoy coming into the town hall. I really love interacting with your staff. They're excellent. They make my day when I come in. We have a great chat. And he goes, it's partly social. So I get that some people aren't, but if that's not you, and you don't want to come and have a chat for a couple of minutes with our staff, e-billing is a great way to alleviate any issues. You're in control of it, and you can just access your bills and stuff whenever you need. So that's a great thing. And thank you very much for all your efforts. The council at the beginning of the term truly asked for what you're doing right now to step up, and the town and our staff are really stepping up for our residents, and that's all we can ask. So thank you so much for all your efforts.
Councillor Conley.
Thank you. Thank you, Amanda, for the report. Echoing a lot of what other people have said, when this council started, it was a strategic plan to improve communication. And I went back and looked at your other reports, and not only are these numbers impressive, they have every year gotten more and more impressive. So it really is working. I want to thank you for not only doing what you're doing, but the initiative taken to come up with new things, to find new ways to contact residents and connect with them. It's been positive. It's been very, very good. At Roma, again, going to some of these sessions, these numbers are incredible. There's communities out there you know, trying to get e-billing going, trying to get connection with their communities, and we're blowing it out of the water. I always feel very proud leaving these things because we're doing what people are saying we should be doing. So good job and keep it up. And the new socials thing was a great initiative. It's a little bit shocking how much goes on in this community. It's amazing to see. My one question with that is it's going out through email at the end of a month for the upcoming month. Will there be a place on the website where they can go and get that information at any given time?
Yeah, so currently right now, all of our scoops are archived on the website, but I can pull them out and create just a special page for the CP Social Scoop and put them in an accessible format, and people can go back and view them if they deleted the email or if they want to send it to somebody that they think would enjoy it. And just speaking to your comment about, you know, going to conferences, I know Jen Mocha has told me that when she goes to her conferences and she tells municipalities our number, they are completely shocked. You know, I go to a municipal communications conference every November, and they always do a seminar on surveys and email newsletters. And, you know, our rate is, it's pretty good. But you know, again, that's not just me. It's a concerted effort. You know, on every email that Jen Mocha sends out, whether it's water billing reminders, she always says, sign up for CP Scoop. There's staff that have sign up for CP Scoop in their email header. You know, Diane tells pretty much everybody who speaks to her that they should be signing up for CP Scoop. So it is a very concerted effort among staff to build up those numbers, and I think we've done a pretty good job of that over the years.
Anybody else? No? Great. Thank you very much for another great year, and looking forward to March of 2026. And moving on to our second report, it is a joint compliance audit committee regarding the 2026 municipal elections, communication 137005. And we will have Stacy Blair Clerk to review this with everybody.
I was just going to back up for a second.
Just thank you for pointing that out. I just realized I will read the suggested motion for the 2025 communication year in review. The suggested motion is the council receive as information the 2025 communications year in review report from the communications coordinator dated January 27th, 2026. If I get a mover and seconder on that. Councillor Comley, Deputy Mayor Tennant. All in favor? And that motion is passed. Thank you. Now we will move on to our second report, which again is our Joint Compliance Audit Committee for the 2026 municipal election, communication 137005. Stacy Blair Clerk. I will read the suggested motion now so I don't forget it later. The council approved the Joint Lanark County 2026 Elections Compliance Audit Committee terms of reference. If I can get a mover and seconder on that. Thank you, Councillor Atkinson and Councillor Sekaspina. And the floor is all yours, Stacy. Thank you.
So this is just a very straightforward report. It's something that we're required to have is a compliance audit committee. It's for if there's any problems or questions about the campaign finances of either a candidate in the upcoming election or a third party contributor. Or anyways, so in the past, forever and ever, the different municipalities of Lanark County have gotten together, and that's why it's called a joint compliance audit committee. So we're proposing to do that again, and the bylaw that's associated with this is the same bylaw that's being passed by all the other municipalities. So that's about it.
Thank you for that, Stacy. Is there any questions or discussions concerning that? Great. We are quickly moving on. All in favor? Opposed? See none. Thank you. That motion is carried. New and other business, we have none. this evening. Committee, board, and external organization updates. We have 3 from the Urban Forest River Corridor, November 26, 2025 board meeting. The Lanark County OPP Detachment Board, December 1st, 2025 board meeting. And the Environmental Advisory Committee, January 5th, 2026 board meeting. Can I get a mover and seconder on those, please? Mayor Randall, seconded by Deputy Mayor Tennant. Any discussions? See none. All in favor? And that has passed. And that moves us quickly along to information listings, which we have 3. The information listings can be found on the agenda page on the town website if you'd like more information on them. The suggested motion is that the information listings dated January 27th, 2026 be received. Mover and seconder. Councillor Comley, seconded by Councillor Kavanaugh. Any discussions? See none. All in favor? And that motion has passed. We will be now going into closed session for a community planning matter, potential purchase of property. The suggested motion is that the committee move into closed session at 6:51 p.m. to discuss matters subject to Municipal Act Section 239-2, proposed or pending acquisition or disposition of land by the municipality or local board. 2, a position, plan, procedure, criteria, or instruction to be applied to any negotiations carried on or to be carried on by or on behalf of the municipality or local board. Did I get that right? That's a lot of ands and ors. And that the following persons be permitted to participate in the meeting: Diane Smithson, CAO, and Stacy Blair, clerk. And Andrew has yes. Mover and seconder. Hands are waving to Andrew or no. Councillor Kavanaugh, Mayor Randall, and we will be back when we finish closed session.
I may or may not be here to close off.
Thank you all for waiting for us. Yeah, for waiting with us, if there's anyone still out there. I will have a rise and report by our CAO, Diane Smithson.
Staff direction was provided in closed session.
Thank you, Diane. And this comes to adjournment. The suggested motion is that the meeting be adjourned at 7:30 p.m. Moved by Councillor Atkinson, second by Mayor Randall. All in favor? And that's it for this evening. Thank you very much. Stay